We are continuing to follow breaking news from Maryland. Governor Larry Hogan on 3 confirmed coronavirus cases.
All 3 of these cases, the virus was contracted during overseas travel. The Maryland Department of Health has notified all 3 patients of their test results. They are currently cooperating and they're in good condition. They're in quarantine and a thorough investigation is underway to fully determine any of their potential recent interactions with the public. We have notified Vice President Pence along with the CDC. We notified Montgomery County Executive Mark Elrick, Montgomery County Department of Health, and the Superintendent of Montgomery County Public Schools. And we notified House Speaker Adrian Jones and Senate President Bill Ferguson. And while this news is serious, I want to again remind everyone that this is exactly what our state has been actively and aggressively been preparing for many weeks now in order to further mobilize all state resources in response to this threat to public health. I have issued a proclamation declaring a state of emergency in Maryland. With this declaration, I am officially authorizing and directing the Maryland Department of Health and the Emergency Management Agency to ramp up coordination among all state and local agencies and to enable them to fast-track coordination with our state and local health departments and emergency management teams. Earlier today, we submitted our supplemental budget, which included $10 million for emergency coronavirus preparedness expenses. We also submitted emergency legislation to allow us to transfer any necessary resources from the state's rainy day fund for further costs associated with the state's emergency coronavirus response. Given the rapidly evolving nature of this threat to public health, it is critical that we have the flexibility to immediately access these resources. And I want to thank Speaker Jones and President Miller President Ferguson, for their cooperation, and we're very encouraged that this legislation seems to have strong bipartisan support, and our expectation is that the legislature will move quickly on this emergency legislation and get it back to us so that we can enact it and sign it into law. At my direction, the Maryland Department of Health has worked with the Maryland Institute for Emergency Medical Services Systems to coordinate surge planning. Health is coordinating with nursing homes and assisted living facilities on infection control protocols. The Maryland Emergency Management Agency has elevated the state response activation level and fully activated the State Emergency Operations Center to further support resource requests from around the state. The Maryland Department of Education has issued guidance to local school systems regarding their authority to determine school closures if necessary. The Maryland Higher Education Commission is coordinating with the University System of Maryland and other institutions, coordinating with them on bringing students home from study abroad programs and potentially canceling other travel overseas.